Good. I think we can start. Good morning, everyone. Before starting, let's all give a great applause to Karnataka Homeopathic Medical Association for conducting this 25 years of the celebration. And so, good morning, everyone. I would like to welcome you all on behalf of Karnataka Homeopathic Medical Association, Doctors Association, to this International Homeopathic Conference 2017. Dear doctors, I would like to welcome Dr. Michael Farras. It is my immense pleasure and honor to introduce our speaker for the today's first scientific session, Dr. Michael Farras. He will be speaking on homeopathy for quality life in cancer patients. Dr. Michael Farras is an MD, professor and physician, Medical University of Vienna, Department of Medicine, Clinical Division of Oncology, Vienna, Austria, and a member, Wisdom Scientific Society for Homeopathy, Germany. Now I would like to invite our second speaker for the scientific session, Dr. Ashok Borkar. And it would be my immense pleasure to introduce our second speaker for this today's scientific session, Dr. Ashok Borkar. He will be speaking on prescribing and pathology. Dr. Ashok Borkar is an MD homeopath, a homeopathic physician from Goa, teacher and consultant physician at TOS Bombay, faculty for British Institute of Homeopathy, New Jersey, USA, author of international acclaimed book, Pathology, Factors in Remedy. Also, I would like to invite our third speaker of the session, Professor Dr. E.S. Rajendran. So, he is the third speaker for our scientific session. He is none other than our beloved Professor Dr. E.S. Rajendran. He is MD Homeopath and PhD Nanotechnology. And it would be my immense pleasure and honor to introduce our third speaker for this today's scientific session, Dr. E.S. Rajendran. And he will be speaking on nature of drugs in potency. And I would like to give his brief introduction to you all. He is a director, Vinayak Mission, Homeopathic Medical College, Salem, first researcher to discover the presence of nanoparticles and quantum dots in the following homeopathic drug potencies. All these research works has been published in 2015 as a book, Nanodynamics. He has presented the maximum number of papers internationally on his research articles. Now, the dais is yours, sir.
Good morning, everybody. This is the first scientific session we are starting with, and we have three eminent speakers, Michael Farras, Ashok Borkar, and E.S. Rajendran. You all have heard about their profiles, and each one is master in their field. We are very fortunate that we have such speakers and such audience, such learners who have come with a lot of enthusiasm. So I request the first speaker, Dr. Michael Farras, to take over the dais and speak on homeopathic for quality life in cancer patients. Please take over, sir. Sir will speak for around 30 minutes.
Chairman, and I also want to emphasize that I have enjoyed the talk of Professor Manchanda because I think India is the land of hope for homeopathy, because despite the great acceptance of homeopathy by the population in Europe, the number of homeopaths is relatively small, and are not enough numbers of trained homeopaths in the future. So if you want to come to Europe to mission, and maybe you might stay because maybe you have too many homeopaths in India, I would like to invite you. So I just want to talk about the influence of adjunctive classical homeopathy on global health status and subjective well-being in cancer patients. It was a pragmatic, randomized, controlled trial. And I want to forward greetings not only from the Scientific Society for Homeopathy from Germany, but also from the Austrian Doctors Association for Classical Homeopathy, the Austrian Society for Homeopathic Medicine, and also the Students' Initiative Homeopathy at the Medical University of Vienna. My background is an academic medical study from 1972 to 78, and I started studying homeopathy in 76. Then I trained internal medicine at the Medical University of Vienna, and I started with a private homeopathic practice since 1990. I was working at the intensive care unit, medical intensive care unit, for almost 20 years, also treating one of the former Austrian residents. And you know, at this time, homeopathy was not very well recognized by the academic community. Therefore, I started to uncover application of homeopathy in critically ill patients at the ICU. Now, since 2004, I am the director of the outpatient unit homeopathy in malignant disease at the Medical University of Vienna. This is a General Hospital of Vienna, whenever you come to visit it. Now, what I'm very much interested, I think there should not be the opposition which you feel in my country very much, because there are sometimes very strong friends of homeopathy, and on the other side, very strong opponents of homeopathy. And I'm interested in a constructive, peaceful dialogue between conventional and homeopathic medicine. And I think there's not enough place for both of them. Now, what is the scope of application of homeopathy in oncology? I think the main field of application is to alleviate the side effects of chemotherapy, radiation, as well as surgical therapies. Furthermore, I think it helps to solve blockades, especially of the mood and psychological blockades. And it might help to heal secondary diseases, because you know, sometimes it's interesting. Patients are not so much worried about their cancer diagnosis, but they're worried more about some rheumatic disease or headache or whatever, and it's very helpful to increase life quality by healing these secondary problems. Another field is the restoration of physiology, and I mean especially women who have lost menstruation during chemotherapy, and if they are allowed to regain menstruation, homeopathy might be helpful. But what is, I think, one of the second most important uses of homeopathy is to strengthen the constitution of the patient and to enhance life quality. And the last question is, maybe homeopathy might improve survival. There are some hints that seem to support this suggestion. Now, we have published in 2015 in Complementary Therapies in Medicines the influence of adjunctive classical homeopathy on global health status and subjective well-being in cancer patients. And this was a pragmatic, randomized control trial. It was performed at the Medical University of Vienna at the Department of Medicine 1, the Division of Oncology, the head up to the end of September with Professor Zelinsky. Now, so all these cancer patients are treated conventionally by means of chemotherapy, radiation, plus minus surgery. And optionally, those patients might opt for additive homeopathy. And there are about 600 patients contacts per year. Now, the aim of the study was to evaluate whether additive homeopathy might help to influence positively the global health status and subjective well-being of cancer patients as an adjunct to conventional cancer therapy. The study was approved by the Ethical Committee of the Medical University of Vienna, and the inclusion criteria were all cancer patients over the age of 18 and prior to the first conventional treatment. Exclusion criteria were the inability to comply with the study protocol and mental inability to fill out the questionnaires. Now, the methods included the elaborate medical history with questions related to social and private circumstances, as we are all used in classical homeopathy. And the symptoms given by the patients were correlated with the signs of homeopathic evaluation of remedies as recorded in repertoires. I have to admit that I'm still preferring books, and of course the younger colleagues are more prone to computer software programs. Now, this part has been written by my third edition, and this sample size calculation was accounted for an expected dropout rate of about 25% of the patients, and therefore we needed a study of about 2 times 190 patients, and this would give an 80% power based on a two-sided significance level of 5%. Now, since some patients did not fill out all the questionnaire, we needed a method to replace these missing values, and therefore there was a multiple imputation method with 50 simulation runs and constraints between 0 and 100 used to impute these missing values for the second and third visits. It was a pragmatic randomized controlled trial, and 410 patients receiving standard anti-cancer therapy were evaluated. They were randomized to receive or not to receive basic homeopathic adjunctive therapy in addition to standard therapy. It was a prospective control trial, and randomization was performed using a computer-generated code. At the end, 200 patients received conventional treatment, while 210 patients individually selected homeopathic remedies in addition to regular conventional treatment. It was an open pragmatic trial, and we didn't use a placebo as a control group. Now we could discuss whether or not this was a wise idea, but we wanted just to compare the complete homeopathic method versus no homeopathy at all. Now, I have to admit that I'm very much influenced with respect to potencies by the Swiss group of Spinetti and Wurster. So we used mostly Q potencies with increasing potencies up to a Q30. Opposite to Switzerland's, we started with Q1. But of course, also C and N potencies were applied and prescribed. Now, the homeopathic remedies were prepared according to the European Pharmacopoeia and Homeopathic Pharmacopoeia, mainly in a pharmacy in Vienna. Now, for those of you who are not so familiar with Q potencies, those are intermillesimal potencies, and a quantitative application of 2.5 milliliters dilution is dissolved onto 50,000 globals. The first preparation is performed until the CH3, and then a dilution and vigorous succussion is performed. I think this is also one of the main problems in the discussion with opponents of homeopathy, they don't know that there's a succussion in that thing. Maybe we should also concentrate our research on just the technical features of succussion. It was Hahnemann's last discovery in Paris, which has been published just about 80 years after his death. What I feel there's a very mild influence on the patient because of the stepwise daily increase and daily succussion by the patient himself. And it appears that there's a quicker healing by frequent repetition with no side effects to the patient, or almost no side effect. Mrs. Moritz is a pharmacist in Vienna, and she prepared the two potencies for this study. Our analysis comprises 373 patients, and we compared the questionnaires between the first and the third visit. The first one was the EORTC, the European Organization for Research and Treatment of Cancer, Quality of Life, questionnaire C30 form, and we had also a specially developed questionnaire evaluating subjective well-being using visual analog skills. This is the official EORTC 2C30 form, and I also think these questions are not really something which helps the homeopath very much, or it's not so equivalent to the homeopathic thinking. However, if you wouldn't use an officially validated questionnaire, then it might not be recognized. This is our special questionnaire. And if you look here, there was no difference with regard to age between the two groups, the homeopathic and the control group, and gender. And there was no significant difference with regard to the entities, tumor entities. There were mostly breast cancer patients, and there was no difference with respect to metastatic disease, chemotherapy, and radiation between the two groups. Now, this flowchart shows you that there was assessment for eligibility in 410 patients. Some of them had declined before randomization, so it was 453, so 410 patients were randomized and allocated to intervention were 200 patients, and 16 of them declined to participate, while 194 received allocated intervention, and all of them answered the questionnaire. In the allopathic group, 200 patients were allocated as a control, 21 of them declined to participate, and therefore 179 patients answered the questionnaires. And less patients showed up during or answered the questionnaires during the second and the third visit. At the third visit, there were 137 patients in the homeopathic group and 145 patients in the control group. Now, I think this is the main result. If you look to the homeopathy group, there was an improvement between the first and the third visit with regard to global health status, as well as subjective well-being, and all functioning parameters have improved, as well as fatigue, pain, dyspnea, and there was only deterioration in diarrhea. If you look to the control group, we have an improvement in subjective well-being, but with a deterioration in physical functioning, somewhat improvement in oral functioning, a deterioration and aggravation in nausea, vomiting, pain, as well as constipation, appetite loss, and diarrhea. Now, the right column compares homeopathy versus control. And again, you see an improvement in the homeopathic group versus the control group, not only in global health status, but also subjective well-being. And in all functional parameters, as well as in fatigue. So, therefore, also in pain and dyspnea. And finally, also with regard to appetite loss. So, if you look here, in many respects, homeopathy patients did better, much better than those of the control group. This is just a table which shows other alternative complementary methods used, such as nutritional supplements, passion flowers, schüssel salts, herbals, and so on. So this is a list of the most frequently used homeopathic remedies. In conclusion, this was the first prospective control study evaluating add-on classical homeopathy in cancer patients at the same center. It was just in the same division of our institution. And the global health status and subjective well-being of cancer patients improved significantly with homeopathy. But not only within the homeopathic group, but also versus the control group. Now I just want to describe a few case reports. This is a patient who underwent cholecystectomy due to cholangiocarcinoma, and there was a partial liver resection, and he received chemotherapy, surgery, and he was suffering from a perspiration on his head. He desires eggs very much. His appearance is very flabby, and he's very headstrong. Now I gave him strychnos notomica, calcium sulfuricum, but actually there was no real improvement with notomica. There was an increasing flatulence in the lower part of the abdomen, nausea, loss of appetite. I gave him lycopodium, and was an unchanged status of the lungs. The chemotherapy was continued. I continued also with lycopodium. But then he presented very outstanding symptoms. He reported that since this chemotherapy, he was suffering from a headache, as if someone stabs a scalpel underneath the scalp from below. So actually, when I was young, I like to read books about Red Indians in America. So I looked to the as if symptoms book of Roberts, and I found a symptom called loosened from back of the scalp. The patient is feeling as if the scalp were loosened from the back of the head. Together with the symptoms of nocturnal perspiration of the whole body, I found that calcium carbonicum might be a good choice, and the next time he reported that the headache has improved very much. Now, to the next follow-up, he reported another outstanding symptoms I've never heard before and after. He had a feeling, a sensation in his feet, as if the feet were inflated. Suddenly the air fades, like the Michelin man, from the tires of Michelin, and it was inflating, and then the air fades. And this happens up to 50 times a day. It's very, very short, it lasts only seconds, but it's very, very painful. So, again, I looked to my book of Roberts, as if symptoms, and I found the system bloated where feet were bloated, together with the complete repertory, the sensation of swelling of the feet. And I gave the patient arsenicum metallicum, and next time he reported that this sensation of inflation in the feet disappeared completely. So he did well, and this helped the patient very much. I just want to show you this observation study of Dr. Schlapper, published in 2004, It was homeopathic treatment of radiation-induced itching in breast cancer patients. He has chosen single remedies individually and gave them in a C30, and he evaluated the success by help of a visual analog scale. And after 3 days, he evaluated the success or unsuccess of the homeopathic remedy. 56% of the 25 patients reacted well to the first remedy, 9 patients received the second remedy, and 7 reacted positively. So altogether, 84% of the patients could be treated successfully. So the most used remedies were acidum hydrofluoricum, Lus toxicodendrum, causticum, ignatia, sorinum, extremicadum bichromicum. Just the second case, a patient with a carcinoma at the root of the tongue. He was suffering from several symptoms, especially swelling of the lower jaw, chin. He was dry mouth, his voice was indistinct. Nightly, he was suffering from foot remnants and ropey mucus at the place of the tracheostomy. Furthermore, his father has died shortly before, and he had a lot of anger in his bank. So there was a burning at the base of the tongue. And he was also worried because he had to shoot his dog, but he approached himself, why did I do that? So I gave him ignatia first, and then, since the tip of the tongue felt as if it was burned, I collected all the symptoms, and I found phosphor very helpful, and it helped to some extent, but finally he had some tumor cysts at the area of the carcinoma, and he reported that barium carbonicum reacted like a hammer. All the symptoms he was suffering disappeared, and he was feeling very well. Just at the end, the quality of life data have been reported by Dr. Montpazieri, and in 451 studies of conventional medicine, he found that improving...
Sir, sorry to interfere. Please sum up in 2 minutes.
Okay, thank you. Thank you so much. So I just want to encourage you to use homeopathy in oncology patients, and I want to finish with Tanya Galu, and she is.
Thank you very much. Since there is lack of time, please note down your questions. If you have, we have an entrance, I think we can send to them. I invite our second speaker, Dr. Borkar, on pathological prescribing, and he has 30 minutes with us.
Good morning. Thank you for calling me here. It's a privilege to speak in front of stalwarts like Dr. Tiwari, Dr. Manchanda, Dr. Patel, and others. I have been teaching for the last almost 7-8 years now. I have been practicing for 27 years. The first 20 years of my practice, I've been using single remedy, single dose constitutional prescriptions. But then something changed, and my whole style of practice changed. So I'll tell you a little bit about that journey with a few cases. I would have liked to show you some videos, but we don't have that much time. There are some homeopaths who always say that we have to prescribe only on mentals and generals. I have heard this in many seminars, and they give very little importance to pathology. And I was very much influenced by this sort of learning and tried to emulate that. And there are other homeopaths who swear that you have to consider the pathology for prescription. So I am here to share my experience on this issue. Let me start with a small case. The first case I'll be showing is of multiple myeloma. And this is a 52-year-old male who came to me in 2012. Came to me, he was brought to me because he was so weak that he couldn't walk. 3 people were holding him and bringing him inside. He could barely lift his legs, there was no strength, his cheeks were sunken. And he was diagnosed as being in the last stage of multiple myeloma because there were necrotic lesions in all the bones. He sneezed and 3 of his ribs fractured. That means he had osteoporosis because of the disease. And life expectancy at this stage of disease is 1.5 years. But this patient was so weak that the allopathic doctors said that you are not fit to take chemotherapy or any other allopathic treatment. So you go to your village and pass off the rest of your life. You don't have much to live. And because there was no hope, he came for homeopathy. Because we could hardly hear what he's talking, he was just mumbling, there was no strength to talk. So the relatives gave the information and he spoke very little. And what he said was he was getting severe pains in different parts of the body. When he would try to move, his muscles would go into a severe cramp. And he would feel very stuck in one position. And then slowly he would move, and initial motion would be very difficult. But as he would move, he would feel better. And his pains were better by that little bit of continued motion. And they were always worse by rest. The pains were as if being pulled tightly. And every moment would produce a cramp. Now, the patient was not in a position to talk much. I hardly got any more symptoms from him. But from whatever I had, I prescribed Prostox. But nothing happened. There was no change. In fact, his pains increased. And after 4 days when I got a follow-up was now given by the son because he couldn't come. But there were some new symptoms. They said that now the pain is so severe that he keeps shouting and shrieking with pain. And even the least motion would produce a severe, sharp, pricking, poking pain. So, the only definite modality was that draft of air, a full fan on him, would make him feel better. And he was constipated. He was not passing motion for many days. Now I repertorized again. And I came to Bryonia. I gave him Bryonia 30. His pain became a little less. But it started again, so Bryonia 30 was repeated. So with Bryonia 30, he would feel a little better, but the pain would increase again. So I kept giving him Bryonia 30 frequently. But after some time, it stopped acting and the pain started increasing. It became so severe that this man was bedridden. And he would shout so loudly that the whole village would come to his house to see what has happened. And this was about a month after I started treatment. At this time, I changed my strategy and I decided to look at the pathology which was there. And I repertorized again, giving more importance to the pathology. So I took all pathological rubrics. Now this is something which I had not done for ever in my life. This was a turning point in my career as a homeopath. So I took the rubrics: softening of bones, necrosis of bones, cramps in the muscles, and cancerous affections. And to that I added the 2 strong mental symptoms which were associated with this pathology: shaking with pain and fear of pain. And I came up with a different remedy. I gave him Orometallic 30. And that worked so beautifully that the pain became less, the pain stopped. Slowly he started getting up from the bed, moving. First he started moving around with the support of a chair. And then he started going out of the house. After about 2 months, there was a relapse of the pain because he had a very bad sneeze and the pain started again. That time I put him on Oromet 6C in frequent doses for almost 15 days. But with that he became totally pain-free. In another 3 months, he started going out of the house. In another 2 months, he started working again. He was working as a groundsman on the local football ground. So he started going for work again. And he was fine for almost 3.5 to 4 years after that. This, as I said, was a turning point in my life. Because I started giving more importance to pathology in pathologically advanced cases. Like Burnett writes, he says, it is not enough to cover the totality of symptoms. For when this is done, we are only halfway. We have to ask, what is the pathology of the malady under consideration? And is the drug chosen capable of producing a real disease like this? Is it really homeopathic to the morbid process? In simple words, the pathological process going on in the body has to be covered by the remedy. This is simple logic of homeopathy, but somehow we were neglecting it. If you want to cure sadness, we are going to give a remedy which can produce sadness. So if you want to cure arthritis, you will give a remedy which will produce arthritis. So if you have to cure a certain pathology, you have to see whether that remedy has the power to produce and cure such a pathology. Another case. Now this was a case in the ICU. So I got a call from the hospital saying that this patient is having continuous hiccups, he is disoriented, he is in uremic encephalopathy. He had ischemic heart disease with hypertension with pyelonephritis, and for that, after that he went into septicemia and antibiotics were given, and there was acute renal failure and then uremic encephalopathy. At the same time, he had a very big ulcer on the foot, such a big ulcer flowing with pus, thick yellow offensive pus. So when I was called, allopaths had already given up. They said, doctor, you see whether you can help. We can't do anything. So in the ICU, I saw that he was continuously breathless, continuous hiccups. That's because of the encephalopathy, uremia. The only thing he was saying was that I get burning here. And he had stopped passing urine, he had stopped passing stool, he had nausea, retching, no appetite, no thirst. Such patients cannot give you much history. But in the past, when I was doing this, taking all symptoms and prescribing the remedy, even in such cases, I would take a detailed mental picture, physical journals and everything and prescribe. But let me tell you, it wouldn't work that well. Very rarely it would help somebody. But now, because I had changed my style of practice a little bit, my prescription was different. So I saw that he had flapping tremors, which is uremia again. Body was cold to touch because of no circulation, dry lips, flabby tongue, and the most important thing to do was to check his pulse. Actually, I spent only 5-10 minutes in the ICU with him. The main thing I did was to go and check the pulse. It was irregular, intermittent, weak and slow. He was in stupor and restless. His investigation showed that his kidney was shrunk. He had a left-sided hydronephrosis, hydroureter. There was fluid around the kidney. There was a renal calculus. There was a left-sided pyelonephritis. There was some echoes in the bladder. Prostate was enlarged. Liver was fatty. So overall, his system actually had failed. His kidneys had failed. His circulation had failed. All his organs were very weak. And it was no longer working to keep him alive. So I took the pathological rubric of uremia, and only symptoms of the presenting state which were very prominent: stupor, anuria, irregular, slow, weak, intermittent pulse, and shrunken kidneys. This was the presenting state, and this state was dominating his health at the moment. So I took only this picture, and there were some other supporting symptoms like hiccups, pain in the burning in the stomach, coldness of feet, dryness of lips. Now I have put these symptoms on two sides because what is seen on the left side is something which is not commonly seen. You don't get patients who are in uremia, everybody doesn't get it. Stupor or this type of a pulse. But what you see on the right side are symptoms which you have encountered in patients. You have seen patients with hiccups, burning pain, dry lips, right? What I have put on the left side, that actually constitutes the genius of the remedy. Genius means the outstanding feature or something which is really rare, that which is not common in all patients and not common in all remedies. That is called the genius. So this is what I prescribed on. And what I got was digitalis. Digitalis 60 was given, 4 drops in half cup of water, 2 hourly on the first day, and then in frequent doses for 3 weeks. The next day he was in the ward. Okay? Completely alright. After a week discharged from the hospital. And he followed up in my clinic for another 4 months. In the first case, no allopathy was used at all. That was a multiple myeloma case. In the second case, he was on anti-hypertensives, anti-blood sugar medicines. Most important, that wound which was there on the foot. The next day, when I went to see the patient, the surgeon had come and he opened the wound and showed me that there was no pus. It was a clean, nice, red wound. I have a whole video of this about a discussion between me and the surgeon, but we don't have time to show it right now. So this patient, in spite of being on a few of allopathic medicines, responded beautifully and was out of the crisis. Now these 2 cases I have shown you that I have given one remedy and it's out of the crisis. That doesn't mean that that's the only remedy a patient needs. This is a remedy for that state. Like Hahnemann says in Aphorism 171, you need multiple remedies, one after the other, to cure completely any given case. Burnett, who probably has the best results in pathologically advanced cases, if anybody has read Burnett's writings, you will know. Even he says the same thing. He says that in difficult, chronic, complicated cases, you require many remedies, one after the other. And he says that he regards this power of utilizing a series of remedies for the cure of difficult chronic cases as only second in importance to the law of cure itself. What does that mean? It means that there are multiple states present in a patient. And we need many remedies, one after the other, to treat these different states. We need a remedy for the totality based on characteristics, what many of us call a constitutional remedy. You need anti-miasmatic remedies, you need acute remedies, you need remedies for the presenting pathology, you need nosodes, you need sarcodes. So many remedies are required during the full course of treatment of any difficult case. Simple functional cases, you take the mentals and generals, prescribe one remedy, the patient is going to be fine for a long time. Now in the first 2 cases, the prescription was based only on the presenting pathology and worked well. Even when we prescribe nosodes and sarcodes, we need to understand the exact pathology. Only then you can prescribe nosodes and sarcodes correctly. And apart from the presenting pathology, we need to know the pathology present in the past history and the family history of the patient also. I'll explain this a little more after another 3-4 slides. Before that, one was small case. In the same hospital, the same surgeon was supposed to operate on this patient, this lady who had emphysematous pyelonephritis with diabetes. And they said you have to do nephrectomy. There is no choice because there was a lot of pus filled in the kidney. But the patient was poor. She was a nurse from the same hospital. So the owner of the hospital calls me and tells me, see, if this patient has to get operated, I have to pay a lot of money. I have to pay for her. Can you help with homeopathy? So I said, let me see. So when I went to see the patient, she was, she had a very intense depressive mental state. because she talked a lot during the history about how her boyfriend was ill-treating her, abusing her, he had other sexual partners, yet she was not able to disconnect from him. She would give him money, she had left her own parents and her own house to stay with him, and he was treating her badly. So she was saying, give me some medicine which will give me courage to leave him. I don't know, he treats me badly, but yet I keep going back to him and be nice to him. A very intense mental state. Okay? Some other physical features. This is the report of the hospital which shows that the last line, that pus was draining. That day when I saw it was 400 ml. And the most important thing I saw in the case was, I said, show me the culture report. It was obvious. And because of that, her kidney was in this condition that it was not functioning. And they had told her to remove the kidney. So I gave staphylococcin. Although she had a mental state of probably natrum mur, I gave her staphylococcin. It worked so beautifully that the blood sugar, which was not coming under control with insulin, came under control. It was like always above 300, 400, it came down to around 100. And so they could give a standard insulin infusion after that. In Boric, it is written in diseases where the staphylococcal is the chief bacterial factor, as in acne, abscess, furuncle, empyema, endocarditis, etc., you give staphylococcin. All this is written in our books. These are not my ideas. I am just putting into practice because I have discovered these things now. And the result was that the pus stopped, then another CT scan was done, the radiologist said it was much better. This was the follow-up CT scan which shows that there is no air in the kidneys, there is only little pus left, and the kidney which was not seen in the previous report was now seen. And this is about 3-4 years back. This lady is completely alright, both her kidneys functioning very well right now, no problems at all. Only thing, I could not help her with the blood sugar. I reduced the insulin doses and stopped it for some time, and then the blood sugar went high again. I'm still struggling with her blood sugar. We have to put her on insulin again, but her kidneys were saved. Later on, I gave her natrum mur, phosphorus, carcinosin, which states were there, but we got her out of the crisis only because of the prescribing on the exact pathology. What I did there was, I gave the same substance which has produced the disease state. That was staphylococcus, right? Now this is not something new which we do. If you read Medoranum from Kent writes that if your patient is not improving, young people who have inherited tuberculosis, then they will become immune to their inheritance. If you read Kent's cases from lesser writings, in all these cases of tuberculous glands of the neck, he has given tuberculosis. What is this? This is for this you need to know the exact pathology present in the patient. I heard many teachers teaching that always we treat the patient in disease and not the disease in the patient. And I was also influenced by that a lot, and that led to a lot of failures in my practice. But that is not true. We have to see the patient in disease, yes, to individualize, because individualizing symptoms are the best pointers to the remedy. But you have to see the disease also in the patient and see the peculiarities of the disease also. Something more interesting I would like to tell you. Hahnemann writes in aphorism 153 that we should not consider the common symptoms of prescription because they are present in all patients and in all drugs. Now, advanced pathological processes are neither present in all patients nor are they covered by all remedies. In Boger Synoptically, Boger writes, he has written this book to make clear the genius of each remedy. So in the book, what is written in under every remedy is only the genius. And he says the genius of the remedy has to match the genius of the patient. And that is the right remedy for that patient at that moment. When you come to, like when we repertorize, our aim of repertorization is to come to a group of remedies. You get 10 remedies after repertorizing symptoms. Out of that, which one do we give the patient? After matching the genius of the remedy. So what is this genius? If you have a look at the book and read any remedy, you will find that what he writes there is the sphere of action is the first thing. Sphere of action means that indicates the pathology, right? First thing, and then he writes modalities next to that. Most important. And in whatever follows, he writes the peculiar general symptoms and the pathological process going on. So, pathological process has to be considered as a part of the genius. I would like to conclude. Advanced pathology, when present in a patient, helps us in individualization because it is very intense and uncommon. We must give importance to the pathology when we prescribe for a pathologically advanced case. But I would like to sound a note of caution here. Our repertories are incomplete. All remedies for different clinical conditions are not listed in our repertory. So don't look up the diagnosis. Don't put multiple myeloma and consider only the remedies given under multiple myeloma. That is not the way to do it. Don't see uremia and consider only the remedies under uremia. That is not the way to do it. Our materia medica is bigger than that, bigger than the repertory. Many more conditions are written, clinical conditions in Boric. Yet, it is incomplete. Sometimes what happens is, you take the modalities, concomitant, sensation, chandrals, mind, and a certain remedy is indicated. And when you see the pathological rubric, that remedy is not there, and you are a little hesitant maybe. So what you have to do is, you have to read the toxicology of that substance. If really the remedy is right, you will find that in toxicology, it will be given that it has the power to produce that pathology, and hence it will cure that pathology. Thank you.
Thank you, Dr. Ashok. You have raised many interesting points, and I think we'll talk. If you have any questions, please write it and hand over to the volunteers. Next speaker, I invite Dr. E.S. Rajendran, professor, and he also is going to tell you some of the new things in homeopathy, some of the changes which has come because of science. So amalgamation of science and art. He is going to tell you about nano-pharmacology of homeopathy. So hand over to Dr. E.S. Rajendran. You have time for 20 minutes.
By now, I have Professor Dr. Fras and Dr. Gorkar. Wonderful clinical presentations. So maybe we are looking in a different angle now. What is homeopathy? The science of homeopathy is what I am going to take in detail here. So here my aim is to see what homeopathy was last 200 years, what it is today, and probably what it is going to be in the 21st, 22nd centuries. So that is my intention to speak here. So the speech is related to homeopathy, a material science, and it is a nanopharmacology. Why I choose to speak this topic? Because we homeopaths from Honeyman believe that homeopathy is a dynamic science which operates at the level of vital force, and it changes the derangements of vital force and regain the health. As students from first year onwards, as medical students, we all learn the same story, which is truly correct. But where the the depiction comes, we should see the history of homeopathy where Hahnemann started his discoveries in 1790, and from 1790 to 1843 he did tremendous work, and he started practicing homeopathy as a pure material science in 1790s. If you go through Hahnemann's writings and Dr. Richard James, Hahnemann's life and works, we will know very clearly Hahnemann wanted to make the science of medicine more accurate, more scientific, and more material. But in the course of events, as you know, Hahnemann practiced homeopathy in the first 10 years with material doses, mother tinctures, grain doses of medicine. And in 1799, Hahnemann had a bitter experience with an extreme aggravation in a child with colicoda. And with the colicodynia, child was almost dead. So in that experience, Hahnemann learned that when you prescribe medicines of similarity in material quantity, it can produce dangerous aggravation to the patient's life. So in 1801, Hahnemann changed his track, and he wrote very clearly when there was epidemic of scarlatina in Germany, he wrote belladonna, 1:10,000 ratio dilution is the best medicine for prevention and cure of scarlet fever. And that was the best result Hahnemann has shown with the dilution of medicine, but that was only dilution, not protonization. Again in 1810 to 1812 period, when he was a professor in Leipzig University, he started making medicine in a form which is called protonization in centesimal scale. And we don't know how he reached that as a chemist and a mathematician, as a great genius. Hahnemann had the internal ability to understand how the procedure has to be done. So he made medicine in 1:100 ratio called centesimal scale of potencies, which we all are using even today. And these medicines have diluted 1:100 ratio into 630, 200, later on 110 and 50 MCM scales. Hahnemann was skeptical. He admonished his students like Dr. Gross, Dr. Staff, Hartmann, when they have increased the potency about it. And he wrote, never do more than 30 because there cannot be anything in the medicine. So Hahnemann was, as a chemist, as a scientist of the time, was skeptical about the high dilutions. But later on when his disciples proved that these high dilutions act better, Hahnemann patted them, congratulated them, and he said around 1817, here onwards I don't have any problem, everybody can use high potencies of homeopathy. So what happened in the course of time? That's what we are going to analyze. Hahnemann's methodology of protonization was unique. And after 200 years of Hahnemann's protonization, nanotechnology evolved around 1960s, 70s, 80s. And in around 1880s and 1980s and 90s, nanotechnology devised a method of preparation of nanoparticles which is called grinding and milling method, which is very, very close to what Hahnemann did 100 years ago. So Hahnemann's genius was somewhere and the science was going in some other direction. So we are trying to correlate these two aspects today. So this is a work which I did from 2001 to 11 to 16 and still I am continuing the work. This is a nanoparticle characterization of nanomore LM1 to LM30 and hypericum 60 to 6cm. Two potencies. This is the first time I am presenting the characterization of LM scale. Previously I never did that. But this is a beautiful presentation of nanomore because you will see what is inside nanomore which you are prescribing to the patients. So here I have done almost more than 35 drugs by now. Covers metals, minerals, plants, invertebrates and all sorts, etc. That is what I published in my work, Nanodynamics, and 7 international papers in the last 2 years. So we know these methods. As homeopaths, we know there are 3 scales we follow: decimal, centesimal, 50 millisimal, or LM scale, which is 1:50,000. We were being accused as doctors of placebo therapy for the last 200 years. But truly it was not that. We were the practitioners of a system which was unknown to us. Maybe unknown to us also. So here, we know that a nanoscale or a nanometer is 1/100000th of a meter. And nanotechnology refers to the manipulation of matter in atomic and molecular level. And the machines we use to study is an electron microscope. And additionally, we use X-ray radiation or energy dispersive spectroscopy, which helps to analyze the elementary composition of the particle which we find. So for the nanomore analysis, I have used high resolution transmission microscope. And for the hypericum, which is an organic electron microscope, that is field emission scanning electron microscope. There are two different types of electron microscopes. We can't use the one for the other one. Why this study was required? When I was published my first book in 2002, the Lectures on Homeopathy and Philosophy, I had a doubt, and I mentioned in that book, the truth of homeopathy may be lying behind the science of nanotechnology, but I was not in depth about that suspicion at that time. So my interest was to know the content of homeopathic drugs, what it contains. Whether it's a simple.
Can the mic technician help him to fix that?
It was a neutral study, and we were not sure what is going to happen. And these work have been published in last 2015 onwards in all these publications, in American Journal of Homeopathic Medicine, that is a lycopodium study from 60 to cm, and International Journal of High Dilution, ferrometallicum 50 from 60 to 50 m as an evaluation of Avogadro's number. Why we have an evaluation of Avogadro's number, we will come to that point. Then again, another research paper in the Middle Eastern Journal of Medical and Pharmaceutical Sciences, comparing between 50 millisecond and centiliter scale of homeopathic drugs. Then another paper I have published recently, that is on homeopathy and material science, the nanoparticle characterization of orometallicum 62 cm. And in another journal, homeopathy and nanomedicine, identification and characterization of hypericum. And this is a work which I have done. And here what we are seeing on this picture is the outer cover of the book is Natromuriaticum LM24, the presence of nanoparticles. So let us come to the study proper now. The Natromur LM1, the analysis you can see in 2 micron magnification, 100 nanometer magnification, 20 and 10 nanometer. So here you can see that when in nanometer scale, the Natromur LM1 contains nanoparticles as small as 0.69 nanometer to 6 nanometer, which is much smaller than the nanoparticles of orometallicum or any other medicine which we have studied. And you can see that the presence of particle unlimited, because what area you are seeing is a corner of 50 micron size, not even a 50 micron, because one template is 200 columns and every column is 50 micron size. These pictures you are seeing is one corner of one column, that is a very small area of 50 micron space. And that small space contains so much of nanoparticles of Natromuriaticum. And you can see Natromur 6, LM6, the particle size varies from 0.86 nanometer to 3.3 nanometer. Particles less than 10 nanometer are called quantum dots, and they have different chemical, physical, biological properties, entirely different from the other materials with more quantities. And when you go to Natromur in LM12 scale, you will find the type of particles, the look of particles are slightly different, but innumerable particles are there with 0.75 to 6 nanometer scale. And see the nanoparticles of Natromur LM18, 0.66 nanometer to 3.5 nanometer. The size, the shape, and the morphology varies from potency to potency. And Natromur LM24, that's what I said in the cover of the book. I chose that picture because it was so nice to see that under electron microscope. It is like when you open the Natromur in the under electron microscope, when I was opening and I was seeing, I was amazed
unlimited number of nanoparticles. If you take one globule of natromur, any of the potencies in 50 millismol, and you will be having millions of nanoparticles in single pill. That makes homeopathy unique. So every homeopath he prescribed a small pill, being blamed as sweet pills for small children, is not true. It is the sweet pills for curing patients. And we have a science which is ultra-modern. Post-modern, I can speak confidently. And when you go to LM 30 of natromuriaticum, you can see the nanoparticle size is so small, 0.23 to 1 nanometer. 1 nanometer is so small. It is 10 Armstrong. 1 Armstrong is 10 hydrogen atoms. This is the size. So you don't know what we are dealing with. We are not aware of what we are dealing with. We are dealing with a science which the scientists didn't know till today. So this is a natromur in all the potencies in LM scale. And they will find unlimited number of nanoparticles. So the percentage of elements in the particles is in natromur when we are doing the EDS. You will see that sodium and chloride covers the maximum amount of nanoparticles of natromuriaticum. You can see it from natromur LM1 to LM30. The sodium covers maximum and the chloride comes next. The impurities are nil I could find in the nanoparticles or the liquid of 50 millismol scale of natromuriaticum, which I have procured from Karthik Bagola from Kumbakonam. They prepared these medicines liquid form and gave me specifically when I requested to them. And this medicine you can see I couldn't find any impurities. The sodium and chloride. Copper what you are seeing is the 10 grit. Is a part of 10 grit, therefore it is unaccounted. Therefore the natromur which I have seen in the 50 millismol scale contains only the sodium and chloride. Probably they are in an ionized form, so their particle abilities will be much more superior than the regular ones. So the method of preparation of homeopathy is unique. It produces something which is unique. And when you go to natromur, you can see the presence of LM1 to LM30 sodium and chloride. Exclusively you are giving the nanoparticles of sodium chloride, sodium and chloride for every patient when you prescribe natromuriaticum. So my dear friends, now we should know what homeopathy is. What is the small bottle of medicine which people think nothing, or energy medicine or placebo or pleasing medicine is not something very simple. It is far incomprehensible for common men. So when we go to the next drug, and this is an natromur particles, as you can see, it is always less than 10 nanometer. And in FSM analysis of hypercom, you can see the particle size are comparatively bigger in the case of organic materials. Here it is 35 to 60, 43 nanometer, but plenty of nanoparticles. In agglomerates, aggregates, single nanoparticles in different shape, different size, different morphology in every potencies. So see the nanoparticles of hypercom 30C and in 200C. And in 1M, you see the 10M potency of hypericum, how it is. See the 50M, and see how the CM potency of hypericum which we prescribe for patients stands. And this is an FSM image of the dispensing alcohol, the standard medicine alcohol which we use for the preparation of drug which doesn't contain any particles. So when you come to the elementary composition of hypericum, you will see that it is mostly composed of carbon and oxygen. Other elements come traces, probably impurities, or silicon may be the leaching effect of the glass. So there are other particles in some medicine, not only the original drug which we intended to give. So that is a truth when we understand what is the content of the drug. And this is a comparative weight percentage of carbon and oxygen in hypericum. And every organic material, I studied lycopodium, I have studied bryonia, I have studied hypericum, I have studied many more drugs from the organic kingdom. Every drug has only mostly two elements, carbon and oxygen. in different proportion, in different dimensions, in different morphology, and they act differently. We don't know how exactly it is happening. So that needs further research. So this is what is called hypericum. You know that it descends what? Hyperaceae family. So what is our conclusion? Our conclusion is these nanoparticles and quantum dots, mostly quantum dots, are seen in all potencies of Nanomoreaticum. Sodium and chloride is present in all potencies. Nanoparticles seen in all potencies of hypericum. Carbon and oxygen are the main components. And when we go through 30-35 drugs of homeopathic dilutions and prove that the presence of these elements in each and every drug, the presence of nanoparticle as the material existence in the highest potencies, what can we call homeopathy is? Then definitely homeopathy is a material science, but a material science in a nanoscale. And that is a reality we should agree. We can't hide. We cannot go with all the paradigms which we have gone through in our life. So when we go to the conclusion, how this mode of action of these drugs happens, in which I didn't do any original studies, but there are many eminent scientists who did wonderful research in this area, like Dr. and many others, Dr. Paulo Bellavite, and many of the doctors did great work in this area. They have proved that homeopathic drugs produces epigenetic programming. How it is happening was not known. But after we come to know that these particles are the basis of homeopathic drug solutions, now we know that these nanoparticles are capable of producing epigenetic programming and other changes in the intracellular level. So, the NB scan, nanoparticles and quantum dots quantum dots specifically have free entry through cell walls, nucleus, organelles, DNA, RNA, and they are capable of producing epigenetic programming. So, what is homeopathy then? What is homeopathy then we should think? Is it a simple placebo? Is it a simple dynamic medicine? Because of your talking standards you are curing the patients? Dr. Francis has shown how the cancer homeopathic drugs are working. By simply speaking, is it going to work? No. There is something. And this is what we are seeing. So my dear friends, these fundamentals of biological systems are managed in nanometer scale. This is something we should know. Refresh your mind. Go back to your first PHMS medical studies. The cells which we studied, and we go back to your second year studies where pathology you studied, where modern medicine taught us, pathology textbook taught us. Cells are the basic unit of life, and diseases originated from the injury to cells and biochemical changes. We believed it. Medicine developed because of that. But that development has limitations. Therapy of modern medicine is fundamentally molecular medicine, because the basic philosophy of modern medicine is based on molecular medicine. But you go back to homeopathy, the fundamentals. The cell is only a package. Within the package, we have thousands of nano units, biologically active nano units. They are DNA, RNA, or lysosomes, mitochondria, and the problems of the health is mostly because of derangement happens in this level, not in the gross cellular level. Cell is just like a cover. So my dear friends, no medicine in the world except homeopathy can penetrate so freely through the cellular wall, through the walls of the nucleus, and no medicine can go directly to DNA and activate an epigenetic programming. So what is homeopathy? What is homeopathy? As homeopaths, we should be proud that we are homeopaths. We should not feel shame or we should not feel shy about anything. We are doctors, we touch us more deeper in the human existence than the other doctors who do it. So when you look at the mode of action 4, homeopathy is truly a nanomedicine. Why I say that? It operates at subtle level than the gross cell. DNA, RNA, hormones, enzymes, receptors, antigens, antibodies, etc. Dr. Kudabush has published more than 20 papers on this subject. You have to read it. Epigenetic programming, how it is initiated. With homeopathic drugs 30 to 100 potencies. And now we know that how it is initiated. We have the answer. So Dr. Hahnemann could be considered as the pioneer practitioner and founder of the concept of nanomedicine. Hahnemann's homeopathy was a form of nanomedicine. And Michael Faraday, the father of nanoscience, he is later than Hahnemann. He did a wonderful job and experiments with nanoparticles, especially gold colloids, and initiated the field which we today know as nanoscience. And his preparations of gold salt that Faraday studied were ruby red in color and were known as Faraday's gold. Whereas Hahnemann, the man we garlanded in the morning with a lot of respect, did a lot of research, and he found homeopathy, which is the concept of a personalized medicine. Personalized medicine is what we are treating. It is not simple personalized medicine like Hahnemann believed. It is a personalized nanomedicine. That goes to the genetic level of each individual, because every individual has a separate, different genetic material. So my dear friends, when you look at the science in a broader way, the science of today is the product of the science or ideas of 16th, 17th centuries, of Newton, as well as Descartes. And these people created a world out of the concept of objectivity and predictability. And the aim of medical science in 18th and 19th centuries became objectivity and predictability in the treatment of diseases. That is why modern medicine evolved to such a great extent. But this objectivity and predictability was limited to the cellular level, to the pathological level. It has not gone to the genetic level because the knowledge of genetics was nil at that time. Now we have a decoded genetic material in front of us. We know how many genes are there, how many chromosomes are there, how the character is formed. And last week in New York Times I read that if you get the DNA of an individual, you can reconstruct the face of an individual. So what we are is based on our genetic material, which is the backbone of our existence, not only the diseases. So there is the point where we are touching. So we need a radical shift in the perception. And as homeopaths, we need to realize the practice of homeopathy will become more definite when we become more scientific and when we are able to go to the objective level and genetic level. So the modifying the theory and practice of homeopathy based on the new understanding is very, 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 very important for us. But there are some material blocks in front of us. We all learned in 8th standard, 9th standard, a great physician, a great chemist, Avogadro has taught us there is a limitation for the division of matter. After that, nothing is there. That is what is called Avogadro's number, and which is the basis of fundamental theory of material science. But my dear friends, in the second paper which I have shown you, homeopathy, the identification of particles in ferrometallic up to 50 I have shown that Avogadro's number doesn't have value in homeopathic dilutions. It may be having values in some other areas, I don't know about it. But in homeopathic dilution, Avogadro's principle is not a principle to evaluate the value of homeopathic dilution. And that is something we should understand very clearly. And therefore, homeopathic dilution is not a placebo, and it is a highly advanced form of science. So the medical science needs to accept these intracellular realities, appreciate the ability of homeopathic nanoparticles to work at intracellular nanobiological units. Therefore, a synthesis of medical research without parts, without partitions, without segregations, without prejudice, we need to have a very open mind in this business. Then we will find what is truth. Therefore, the homeopathic research has to be integrated with the research of nanomedicine and nanoscience. And here you know the basic nanomedical research going on in the last 20 years, which billions and billions of dollars are spent around the world, is based on transportation of medicines, chemotherapy especially, to the target cells in the cancer patients. And which is a never-ending process which will never yield result because these nanoparticles are the real drugs, not the chemical medicine which you are trying to transport. This is because of one of the theoretical confusion of modern medicine, because modern medicine believes that diseases are coming from outside. Bacteria produces diseases. Carcinogens produces diseases.
Please
yes. They produce diseases, but at the same time, internal problems of the genetic material is more basic than the external causes. There are homeopathy touches. I just finished. So, my dear friends, this present research finding says that homeopathy is not a dynamic science, which Hahnemann said as a conjecture, not as a final answer to the homeopathic dilutions. He said it is an opinion, it is an idea, it is a consolatory remark by Hahnemann to his followers. Therefore, homeopathy is a personalized medicine, it is a personalized nanomedicine. What we are doing as a homeopaths, homeopathic individualization of a patient is a way to sketch the genetic blueprint of the person using individual expressions of signs and symptoms. So that is what we are trying to say, and as homeopaths we should be proud that we are the practitioners of evolving futuristic medicine, that is medicine for 22nd century. Thank you so much. Thank you so much.
Speakers, my dear students, the first scientific session comes to the end. You must have witnessed a lot of informative things which comes to you. To conclude, I have a few points. First speaker was Dr. Michael Frass. He presented something about improving quality of life in cancer patients. Like Michael, the wonderful session you had has given a lot of information. Mainly, how to conduct research. Because his paper has highlighted a lot of points which can be taken, which should not be taken, and what are the points to be considered, symptomatology, to consider how the research can be done in such patients. Also, you have invited us to Vienna. Thank you for that, and we'll visit your Vienna once. Thank you very much. Second, we had a speaker, Dr. Bodka, and he has presented you the change. Actually, this is not a change. He also has said, everything is mentioned in our literature. We have to have interpretations and different methodology in different cases. What he was telling that some people take mental, some people take only pathological, some people prescribe only tincture, some people prescribe only on physical symptoms. These are as per the cases. There is no general statement that mental symptoms should be taken for all the cases. Even pathological symptoms should be taken for all the cases. No such statement is done. And he has quoted example of Burnett. Boger was a person who has first mentioned about the tissue changes, tissue affinities, and a lot of symptoms like necrosis, degeneration, atrophy, all those pathological, general pathology symptoms has come in his repertoire. So Dr. Boger, you have followed the stalwarts and you have brought them into practice. And it's a wonderful thing that you have presented a lot of incurable cases so far, where you have shown good result with homeopathic medicine. Also you have said something about synoptic key, which nowadays people don't refer. I request all the students who are present here, along with the Allen's keynote, please refer synoptic key also. It gives a lot of good information about peculiar symptoms, pathological symptoms, sphere of actions, relationship. So that is one thing which he has said, and his cases has really enlightened. I think it has given a lot of insight to our students. Thank you for the presentation. He has been presenting such scientific papers in different gatherings. When we were in Leipzig, he also presented such a scientific paper. And he said it as a Leipzig declaration. No, Dr. Rajendran, that was very nice. Now, this has given, like Dr. Manchanda also was telling, the nanotechnology, the nanoscience, coming to homeopathy is going to make a lot of changes. But, as Dr. Manchanda was telling, it has to be standardized. Whether the same type of cluster or particles, the bunches which we find in one potency of one medicine, can say that this is the criteria to identify the potency. For example, if natrium pure 200 has shown a kind of cluster, if any natrium pure 200 we want to check whether it is real or not, whether we can check with the same cluster. That kind of things, if it comes, then homeopathy is going to be pure scientific. And it's a future medical science. As he has said, a lot of good things about scientific, bringing scientific things into practice. I think our students must take it as something which is coming new to this science, new to the homeopathy. And think something, you can do a lot of things in future. Homeopathy needs young mind, because a lot of things we say and we say again, Hahnemann has said like that. That is not the explanation. Once I was discussing about 50 minutes in some of the gatherings. They said nothing, only Hahnemann has said that it doesn't cause aggravation, that's all. Why it does not cause aggravation? People could not answer only because Hahnemann has said it doesn't have aggravation. We have to think of those things. So his presentation has really brought some of the insights, thoughts. It's a thought-provoking. Where science can come in homeopathy, and when we can say that this is a pure science. No doubt, homeopathy is beyond science also, but it is based on a practical science. So with these few things, the first scientific session comes to end, and I really thank the speakers, audience for cooperation. Thank you very much.